Program Manager for the Commission and the organizer for this webinar. This hearing is being recorded and will be made available sometime next week on our YouTube channel. The documents which will be discussed here today are available in the handout section and on our website, which is wmc.wa.gov. All attendees are muted. Panelists may unmute themselves and share their webcam. Attendees, if you would like to testify, please raise your hand. Please use the raise your hand function. If you have a question, please either use the raise your hand function or submit it in the questions box, and I will get to your questions as quickly as possible. At this time, I will begin the roll call of panelists and staff. When I call your name, please introduce yourself. So we will start with Ariel.
Good afternoon. My name is Ariel Page Landstrom. I am a supervising staff attorney for the Commission.
Thank you. And then Christine.
Sorry about that. I'm getting to the unmute button. This is Christine Blake. I'm a public member of the Commission.
And then Dr. Curry.
This is Diana Curry. I'm a medical commissioner.
Dr. Gallinger.
Hi, Harlan Gallinger, my first year on the commission.
And then Heather.
Yeah, hi, I'm Heather Carter. I'm an assistant attorney general and legal advisor to the commission.
And Jimmy Bush.
I'm Jimmy Bush. I'm the director of quality and engagement.
And Dr. Chung.
Hi, I'm Jimmy Chung. I'm a general surgeon and I'm on the member of the commission.
Mr. Malden.
Yes, John Malden, public member, commissioner, and current chair.
And Marissa.
I'm Marissa Courtney. I'm the licensing manager.
Melanie.
I'm Melanie DeLeon. I'm the executive director for the commission.
Micah.
Micah Matthews, deputy executive director for the commission.
Mike Farrell.
Michael Farrell, policy development manager for the medical commission.
Dr. Lyle.
Sarah Lyle, I'm a medical commissioner.
Mr. Rogers.
Scott Rogers, a public member commissioner.
Stephanie.
I'm Stephanie Mason. I'm the public information officer and legislative liaison for the commission.
Dr. Murphy.
I am Terry Murphy. I'm a commission member.
Ms. Schimmels.
Hi, I'm Teresa Schimmels. I'm a physician assistant member from Eastern Washington. Physician assistant commissioner from Eastern Washington.
Dr. Yu.
I am Yaling Yu. I'm public member of the commission.
And then Mr. Anderson, if you would introduce yourself and then read the script, please.
You betcha. My name is James Anderson. I am a PA and I'm a member of the commission, and I am the presiding officer. And as such, I'm going to proceed here. Good morning. My name is James Anderson. I'll be the presiding officer for today's rule hearing. Today is September 22nd, 2021. It's now 4:13 p.m. This hearing is being held virtually via GoToWebinar. I'd like to say a few words about today's hearing. The proposed rule being considered today is Chapter 246-918 WAC, Physician Assistants, revising physician assistant rules pursuant to Substitute House Bill 2378 and updating PA rules to incorporate current national standards and best practices. So for today's hearing, all comments will be summarized and a summary will be sent to those of you who provide comments. We ask that you please do not interrupt individuals who are testifying. And if you're not comfortable speaking in front of the group, you may provide your written comments in the chat window. This hearing is being held in accordance with the Administrative Procedure Act, Chapter 34-05 RCW. Pursuant to the Administrative Procedure Act, this public hearing is being recorded for the official record. The proposal, or CR-102 rules package, for this rulemaking was filed on August 18, 2021 at the Code Revisor's Office as Washington State Register number 21-17-142. Are there any questions about the rule or the hearing process before we begin the testimony?
So it looks like Melissa has her hand up. However, I think she might be wanting to testify, but I will go ahead and unmute her.
Yes, I'm sorry, Amelia, that's correct. I put my hand up to testify.
Okay, thank you. There are no other hands raised at this time.
Okay, so please be advised all that questions asked during this portion of the hearing are not considered testimony and will not be a part of the rulemaking record file. When testifying, please limit your testimony to the content of the proposed rule. If you have suggestions for changes, please be specific as to which subsection of the proposed rule you think the change needs to occur. When you testify, we ask that you please state your name, who you represent, and whether you support or oppose the proposed rule. At this point, I am opening the hearing for public testimony. Please use the raise your hand feature and we will.
So Melissa has her hand raised, so if you'd like to go ahead.
Thank you very much. My name is Melissa Johnson, and I am representing the Washington Association of Nurse Anesthetists. And I first just want to thank the Commission for the time and attention you have done for these physician assistant rules. There has been so much time devoted to the stakeholder process, and WANA and our members appreciate the opportunity to have participated in that. My comments are focused on the section of the rule that allows physician assistants to administer general anesthesia and intrathecal anesthesia. The rule language has changed throughout this process. Originally, the rule would have allowed a physician assistant to administer general and intrathecal anesthesia with on-the-job training. WANA, along with the Washington State Society of Anesthesiologists, strongly opposed that provision, and it was removed from consideration. The rule now requires PAs to complete an accredited anesthesiologist assistant program. WANA maintains that in order to protect the public to the highest degree, any physician assistant who is delivering general or intrathecal anesthesia should show evidence of the same level of education as a nurse anesthetist or a physician anesthesiologist. Because physician assistants practice unsupervised, we believe that it is imperative that they have the same level of education in administering anesthesia as CRNAs and anesthesiologists do to ensure the safety of the patient. Again, thank you for the opportunity to comment on these proposed rules.
Thank you, Melissa. So there are no other hands raised at this time.
Okay, so if there's no one else who wishes to testify, I'm going to close the testimony portion of it. Oh.
We have one more hand raised. Hold,
All
please.
right. There we go.
Chelsea, if you'd like to go ahead.
Thanks so much. Good afternoon, everyone. My name is Chelsea Hager. I'm the contract lobbyist for the Washington Academy of Physician Assistants. And I just wanted to make a couple of really quick comments here. First, I just wanted to thank all of the work that went into the stakeholder process and coming up with the language before you today. We really appreciated that the Commission slowed things down and allowed some stakeholder work. And while WAPA would have liked to see an opportunity for on-the-job training so that PAs could get the necessary education and training to be able to provide general and intrathecal anesthesia, we are appreciative of the way that we were able to arrive at the final language here, and hope to revisit the conversation in the future if appropriate. So I just again wanted to say thank you to all of you who participated in the process. We certainly appreciate the time and attention that was taken to this rulemaking process.
Thank you, Chelsea. So now there are no other hands raised.
Okay, so for a moment.
No question.
If there are if there's no one else who wishes to testify, then I'm going to close the testimony portion of this hearing. Next, I'd like to ask, has the department or commission received any written testimony from members of the public related to the rules filed under WSR number 21-17-142?
Yes, we have. It is on the screen right now, and it's also in the packet, and it starts on page 23. And basically, the Washington State Society of Anesthesiologists would like us to change a portion of the rule language that you can see here. Let me make this a little bigger. There we go. They would like us to change this portion of the rule that says performance of general or intrathecal anesthesia clinical duties pursuant to a valid practice agreement prior to, they would like us to take out the adoption date of this section and change it to July 1st, 2021. And their reasoning is below. It's the sentence here that says the administrative delays in adopting the final rule may lead to an unintended expansion of a temporary waiver that was anticipated to expire well before the end of this year. Establishing an expiration date for the grandfather clause is necessary to prevent this. And Heather, if we did make this change, would that be considered substantial enough to send us backwards in the rulemaking process?
So generally, when you're looking for whether or not something is substantial or a substantial change, you're looking at whether or not it would change the, expectations or eligibility or criteria for something. And, by their own statement, it does change it does make a change. So that I think could be viewed as substantial or substantive change. That said, you can go back and change it if you'd like, and start start the CR 102 process over.
So that's up for the commissioners to discuss then. Excuse me.
Amelia, this is Micah.
Mhm.
Could you give the commissioners an idea of what that means to go back and start the 102 process with respect to meetings and timeline?
So if we did that now, it would be several months before we could have another hearing. It would be at the earliest November before we could have another hearing. And as you all know, it has been difficult to gather a panel, a quorum, over the last few months. And so, I mean, it could be problematic. I do think the points in the letter are valid. I don't know if there's a way we could change it in the future. I'm not sure. But it would be several more months before we could finish the filing of this rule if we decide to go backwards. Yes, Teresa.
I'd like to go ahead and proceed as the rule is written. I understand, and I agree that there is some validity to the adding this change, but we've had ample opportunity to hear from the stakeholders, and I think that we should proceed with the way that it is written at this time.
Is there further discussion about this? I have a comment, but I'd like to wait and see if anybody else has comments about it.
Could we elaborate a little bit on what the risk is that the Anesthesia Society is pointing out here?
Mr. Farrell, could you speak on that?
Yeah, sorry for the delay. The letter is stating that, well, the way the rule is worded now, it's essentially a grandfather clause, the way I read it, and that is that any PA can get, if I'm reading this correctly, any PA can get a practice agreement signed before the rule takes effect that would allow the PA to administer anesthesia, general and intrathecal anesthesia. And that PA could get without the training in sub A, could get the practice agreement and be allowed to do that today or anytime 30 days in the future until the rule takes effect. This letter would set a cutoff date of July 1, so that a PA today, without the proper training, could not have a practice agreement that would allow the administration of general or intrathecal anesthesia. So it's a timing issue.
Can I ask a question?
I understand the timing issue. I'm just wondering from a clinical standpoint, what is the real risk? Like, I mean, I think my question is really more about does not doing this create a risk of providers not getting the training that they should be getting?
And I can't address that.
I'd like to make a comment about that. This is James Anderson. When we had the earlier hearings and discussions about this, I think the commission did the best that could be done as far as trying to find data about, is there anybody doing this? Or are there any PAs doing this? And as I recall, it was our conclusion that while there was lore of some PAs doing this, in fact, we could find no evidence of any PA currently practicing in that way. And that's my recollection.
Dr. Curry?
This is Diana Curry. Yeah, James, that was my recollection too. And I just want to clarify, if we say the date of adoption, it's 30 days from now. So like potentially somebody could find out this rule was passed and within the next 30 days try to get a practice agreement that allows them to do general anesthesia. Is that what I'm hearing you say?
Well, and is that even true? Because if the date of adoption would be today.
Right.
Correct, Heather?
Usually the adoption date is the date, or well, I guess adoption, where does it say?
Let's see. Let's
Prior
go
to
to
the adoption
102.
date. Yeah, I need to look at that, but there's probably a difference between adoption and effective date. I would note that it doesn't require just a practice agreement. The statement is that they are performing. There's the performance of this. So they need to be actually practicing and doing general anesthesia under a valid practice agreement. So it's more than just go get quick practice agreement signed and train later or something. They need to be actually performing the anesthesia.
So we do have one hand raised. Do we want to take that comment now?
I think that's fine.
Go ahead, Amy.
Hi, everybody. Thank you very much. And I really appreciate this discussion. I'm Amy Brackenberry. I'm with the Washington State Society of Anesthesiology. We submitted the letter, and I think that I think you all understand, the concern that the society raised in the letter. It was, if there are more delays in adoption of the rule, the way that it's written, it could potentially be, a year from now until the rule is adopted, in which case, someone who isn't currently practicing could put a practice agreement in place and be practicing. And so the uncertainty about the timing of the adoption of the rule and the effective date of this grandfather clause is what prompted the society to submit this comment, suggesting maybe we need to put a date certain so that if there continue to be, or so if there are delays in adopting the rule, that doesn't create a giant unintended loophole, because I do recall that, you know, the commission did not find, I thought there were, for some reason I have 7 in my mind, that maybe they said there might be 7 people, but that might have been from the PA Association too. But just, you know, okay, grandfather the people that are currently doing it, but not creating a giant loophole for someone who may want to do this in the future, and just the concerns about the timing. So I just wanted to say that that is what our concern is. You know, clarifying the adoption date and therefore effective date of this piece might address some of the concerns.
Thank you, Amy.
Amelia, I've got
So,
something.
go ahead.
Sure. So I agree with you on that. The adoption date would be today. Historically, when the commission has adopted a rule, there's 2 decisions they make. One, are they going to adopt it? That would be the day that they do. But you can set your effective date at pretty much any date in the future. I would defer to Heather about if you can set an effective date in the past. I think that would be a little awkward. The other thing, just responding to the Anesthesiology Society letter, I would recommend you keep the language as it is, given that the adoption date is today. By setting the date in the past, I think you run the risk of someone who, without having knowledge of what this process was, would run afoul of something that you know got changed at the last minute. And then to address Dr. Gallinger's question, per House Bill 2378, the Commission no longer approves practice agreements. They have to be filed with us, but we don't approve them before people start on them. So that was a change that was made in the legislature, I believe, last year.
So let's see. So Amy, did you re-raise your hand?
No, sorry, I think I was trying to put it down. Sorry.
Okay, that's all right. So there are no other hands raised, and that comment from WSSA is the only comment we received during the
Christine
comment
Blake has her
period.
hand up.
Oh, go ahead, Christine.
Christine, hand up.
Sure, I would agree with what Teresa said, and there have been multiple times that we've met over this and requested input, and I think that we should leave the language as is.
Go ahead, Jim.
I would strongly concur. And so what are our options here procedurally now? Do we need to have a motion to deal with this, or can we make no motion and move forward? What are our options now?
So you should, I think it would be a good idea to go ahead and vote to leave the language as is, or you can just vote to approve the language as is, you're approving to adopt it as it is. You could just do that vote.
I would be happy that
we would need a motion.
I would be happy to make that motion that we adopt the rules as is, with the adoption effect date as of today.
Second.
So with no further discussion, or is there further discussion from the panel?
So if you have anyone that's
Okay.
opposed, they could discuss.
Sure. And if there is no further discussion, then why don't we vote? All those in favor of the motion, noting that the adoption would be today, please raise your hand or say aye.
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 Any opposed? Any opposed? Okay, it appears to me that carries unanimously. Thank you.
Then Jim, you just read that last little line of the script. You're muted right now.
I was just trying to mute myself going, I'm sorry, pardon me, I'm going back to the script here. There we go. So will the commission consider a motion to adopt proposed language for chapter 246918 WAC physician assistants?
Yep, you've done that.
Someone,
Just the very last line that says, thank you for
all
your
right,
participation.
great. Thank you. And I do thank you for your participation, even besides the fact that it's on the script. Thank you very much, all of you, for participating. And the hearing is adjourned, and the time is now 4:35 p.m. Thank you very much.
Thank you,
Good
everyone.
job, Jen and everyone.